Hello, and welcome to our webinar series on the 8 professional competencies for preventing drug misuse among college students. I'm Rich Lucy, Senior Prevention Program Manager in the Drug Enforcement Administration's Community Outreach and Prevention Support section. DEA is pleased to be part of this project to highlight the skills necessary for coordinating comprehensive campus efforts to prevent drug use. While we have made significant progress with these issues over recent decades, much more remains to be done. The foundation for this webinar series is a publication prepared by Dr. David Anderson, Professor Emeritus of Education and Human Development at George Mason University. The document was produced with funding from the Mid-America Prevention Technology Transfer Center, which is funded by the Substance Abuse and Mental Health Services Administration. DEA is pleased to continue its partnership and collaboration with SAMHSA and its Center for Substance Abuse Prevention. Over the course of these 8 webinars, we take a deeper dive into each of the core competencies that are designed to promote enhanced professional skills and ultimately affect college students' decisions surrounding drugs and alcohol. This second episode focuses on drugs and alcohol, including attention to the importance of understanding their effects on the body, motivations for use, consequences, risk and resiliency factors, epidemiology, substance use disorder, intervention, and recovery. This webinar includes, among other things, a focus on what is unique and relevant for higher education, such as the campus setting, the range of audiences and populations, the continuum of use, and individual and group risk factors. The information you will receive during this episode is an essential foundation, whether you are working full-time or part-time on prevention efforts. It's our hope you and your campus benefit from the information being shared in this webinar. We think you'll find many ways to put the insights and contents to good use. With that, it's my pleasure to turn over today's episode to our host, Dr. David Anderson.
Thanks so much for the great introduction, Rich. I appreciate what you're doing and what your colleagues at the DEA are doing, not just with this webinar series, but with all of your good work with drug misuse prevention across our country. We've made a lot of progress in recent decades, in my view. We have a long ways to go. And that's why we came up with this resource, the Guide to the 8 Professional Competencies for Higher Education Substance Abuse Prevention. This is available at www.preventioncompetencies.org. And it's also available on your website at the Drug Enforcement Administration. So to help pull this together, I convened a group of 5 experts from around the country, from different regions of the country, different levels of experience, and they helped conceptualize and put this together, this resource, which is aspirational in nature, about what does it take to do in a professional way, in a grounded way, drug and alcohol misuse prevention on our college campuses. So one of the experts is Dr. Tom Hall, who serves as the director of the drug-free office in Orange County, Florida. Welcome, Dr. Hall. We're glad to have you here today.
Thank you, David. I'm happy to be here. And, I have been at this since about 1992. And so I've got a wealth of experience, or I'm old. So we'll let the audience.
So you mean active in drug and alcohol misuse prevention?
Yes, psychotherapy, drug use prevention. So I've run the gamut of mental health and substance use prevention, treatment, and recovery over that time span.
So in that, Tom, that was with community settings and campus settings both?
Yeah, so I worked in a hospital-based system for about 8 years, and then I also did private practice for about 3 years.
Okay. And then on college campuses, helping to orchestrate comprehensive programs.
Yeah, that was about 18 years. And then I've been with the county for 3 years as basically I'm kind of a drug czar. I make recommendations to the mayor and his staff around policy decisions and how to allocate funds.
So diving into this, one of the Rich highlighted the overall framework that we have for this set of competencies, 8 competencies, and we're talking about one today. We're talking about drugs and alcohol, and I know all of these intersect. So with this, can you talk a little bit about the drug and alcohol competency area itself? What I know we're talking about substance misuse prevention. So why do we need to have this? Why is this an important part? Why did we, as a group of 6 of us, include that as a specific competency area? Why is it important?
Yeah, I think it's important to recognize that when we're talking about substance use prevention, prevention is broad and it covers a continuum all the way from universal messages that are geared towards the general population through very specialized messages that address, even in the prevention side, those people that we have known risk and but yet don't need, they need intervention or education, but not therapy. But there are those folks who need therapy. And then there's students who get into recovery during their collegiate years. And so we need to support them as well. So, it's not just one thing. It covers a wide gamut. And it means there's a lot of room for education and specialization within that. And I think that's, in my 20 some odd years in higher ed, that was one of the issues, is trying to get administrators to understand this is multifaceted. A group with RAs was good, but we also needed to recognize that there was those students who were using in ways that was dangerous, that we needed to focus on. And I want to say one thing about this, going back to that point on the universal side. I think too often we forget the students who don't have problems, and they're just as important. We need to have programming and interventions for those students who don't drink or drink minimally, because that's supporting their lifestyle in the university with all of the myths around all college students drink. This is a time to sow your wild oats. That's just not true. And we see that over and over and over again in the data. But for some reason, we tend to focus on those issues, not on the strengths.
That's so interesting. You mentioned, there's so much to unpack there, Tom. A lot of the myths out there, like everyone's doing it, everyone's using this substance because it's legal, it must be safe. That's a myth. It's perceived as safe. New things that appear on the scene, a lot of the dangers there, and a lot of people, the idea of, well, these are college years, this is for experimentation. Some thoughts that relate to these substances, drugs and alcohol. And I know the DEA is constantly putting out information and trying to counter a lot of that myth. What's particularly relevant for college campuses?
Yeah, so there's so much, like you said, so much.
I know. We could go for hours. That's a whole different direction. But
so I want to talk about catering to those students who don't use first. When we think about that population, whether it's first-year students or sophomores, juniors, it's important to provide them a space on college campuses. I know the campus I worked at, it pretty much shut down at 10 a.m. or 10 p.m. And so if you didn't have a car, there wasn't a great bus service. It was far from downtown. The thing you had most access to were bars. And so for those students who chose not to go to bars, there wasn't much for them. So we put together a coffee house on campus that ran from 11 to 2 a.m. And we would have 100 students show up to that. And what was interesting was it started out, it was in a residence hall area, a big room that we put couches in and turned out the fluorescent lights and brought in lamps. And so it was really a comfortable setting. And we would have students really all the way through their junior year that would come to this program. And to me, that illustrated the importance of providing the institution has a responsibility to provide at least as much entertainment as the community is providing, and the long-term negative impacts when we see students convert from, say, no use or minimal use to this more dangerous, risky, heavy use. And so from there, I want to talk about prevention from the standpoint of, we have, when we think about prevention, there's universal, indicated, or selected and indicated. So universal is those posters and coasters kinds of things.
I have this for you.
Yeah.
Yeah, you're talking about the protractor, universal selective and
Yes,
indicated.
the institution of medicine. Yeah, they put this out and it's really helpful. So universal, you've got posters and coasters. Then there's selected, where you begin to focus on a group that you believe is, could benefit from a prevention intervention. And then you've got indicated, which really starts to focus on individuals within that high risk group. So when we talk about prevention, it covers the gambit from those students who don't use on the universal side, all the way up to those students who have begun to demonstrate issues related to their use, whether it's failing grades or being caught in the residence hall or off campus with alcohol. They could have been pulled over and given a .02 DUI. And so that's one piece, and it's a very important piece. But then there are students that need professional intervention, so treatment. And so our campuses have to be able to respond to that treatment, whether it's in the community or on campus. I mean, there's some benefits to having treatment on campus. It allows, there's a better understanding of what's happening. But off campus, you can find very good treatment in the community as well. That really varies from campus to campus. And then lastly, I just want to talk about recovery. That's the last piece in this. And so it's real important when people get into recovery, they have a home. The first year I worked at the university, so we're going back to 2002, there was a student who had a cocaine addiction I worked with. And because my prior experience as a treatment professional, I was able to get this person into a treatment center. 4 years later, he walked into my office. I kind of remembered him, but I didn't. And he shared he was in recovery and he was going to another school. And I asked him, so why didn't you come back here? And he said, well, it was too triggering. This campus was high risk for me. And that really made me sad. And I began to look at, well, what do we offer students who come back to college and they're in recovery, or they get into recovery while they're here on our campus?
So with what you just said, with that high risk environment for that particular student, and we face that a lot. And then what you said a few minutes ago about when at a university they set up, what is it, 11 p.m. to 2 a.m., like a coffee house. All of this again goes back to our model and the center words, the 3 words: health enhancing environment. Yes. That latter student found that it was a high risk environment. And so going back to your earlier comment about administrators and campus leaders being more intentional, if I may, about promoting a health enhancing environment. And again, using universal, selective, and indicated, tying in risk and resiliency factors for the environment and for the individual. I mean, and how this whole piece with drugs and alcohol fits right within that.
Yeah, we know that within the campus community, we've seen drugs and alcohol as a concern for decades. I mean, for you, it goes, I won't say how far it goes back for you, David, but it goes back
almost a half century, my friend.
Yeah. Yes. And so the issue there is, how do we get people to conceptualize this as more than just a problem oriented, and we jump from one problem to the next, as opposed to having a strategy that's broad, and that we act from a standpoint of health and not fear. We're not reacting to a health threat. We're responding to the needs of our students. And and that's one of the things I'm a big supporter of well-being and wellness, but we just have to be careful that we don't bury within that structure alcohol and drug prevention, treatment,
Right.
recovery. Case in point, you can have a high-fat diet, and you may develop heart disease 20, 30 years down the road. Take a counterfeit Adderall, and you could be dead in 5 minutes.
Yeah.
And that's the difference, and that's why we have to gauge the risk and what's the immediacy of our intervention versus just looking at all interventions in general.
Yeah. So just with that, what's your sense? How bad is the drug alcohol problem for our college campuses? And then college campuses, a lot of overlap with our society.
Yeah.
I mean, how
Yeah.
bad?
So, I'm looking at broader data now, so at the community level, but I
Okay.
will say 18 to 25-year-olds are the emerging group where we're seeing more and more issues with overdoses and overdose deaths. And as you know, or if you don't know, you need to become educated. Fentanyl is cheap to make, easy to transport. We'll likely never see heroin or any plant-based opioid sold on the street, just because fentanyl is so easy to make, and it requires nothing. So
Right.
sorry, my phone is going off here.
Okay. So with that, what's our what's death and injury? If you talk about fentanyl, you talk about other opiates, you talk about
Yeah.
alcohol. I mean, what?
Well, the DEA has a wonderful campaign called "One Pill Can Kill," and I mean that sums it up. What we're seeing is the proliferation of counterfeit pills, as well as fentanyl poisoning and other drugs, is unprecedented. Every 5 minutes in the United States, somebody dies of a drug overdose. So,
Drug overdose generally, or fentanyl?
generally, but
Okay.
about
One every
80%,
5 minutes. That's a lot.
yeah, and about 80% of those overdoses involve fentanyl.
Okay.
So the vast majority involve fentanyl. And I mean, that's a staggering number when we think about, every 5 minutes somebody's dying.
So just with that, Tom, just with that, that's a perfect example as we get into the 8 specific competencies within the drug and alcohol cluster. The first one being incorporate current information.
Yeah.
And we didn't talk about fentanyl decades ago.
Right.
And what are we going to be talking about decades from now? I mean,
yeah. Well, it's interesting when we talk about harm reduction, that it's become fashionable to talk about harm reduction with alcohol, and to some degree, to a lesser degree, marijuana. But when you talk about harm reduction with prescription drugs, with methamphetamines, with cocaine, you've gone from preaching to meddling. The idea that you're going to tell students, or to really tell anybody, you need to cut back on your use versus abstinence only, is really pervasive when we talk about harm reduction. So, it's okay. Harm reduction is okay in this setting, but it's not in others. And I know that's a big leap for colleges, but it's a reality out there too. And we need to look at our strategies to see where we can apply harm reduction. So there may be situations where we can apply it. There may be situations within the code of conduct that it's just a non-starter, but we can't bury our head in the sand and pretend it's not happening, because it is.
Yeah, so I know that this is covered in some of the other webinars, the one on prevention science. I mean, you're talking about the science guiding your campus decisions, rather than the feel good. You're talking about posters and coasters a bit ago. So that's more of a feel good. But what is the science with harm reduction? And this is not posing a question. It's just showing the linkage. And then as you get into strategic planning, one of our other webinars, one of our other 8 areas here, being more intentional. So thinking about all of that and guiding our decisions as we think about these 8, some other thoughts that you might have that help inform our viewers, how do I think about this? How do I think about this a little differently?
Yeah. Well, I think it's important to not be afraid.
Okay.
I think it's important to seek out information, look at what's happening in the larger community, talk to treatment and recovery groups. We should be very familiar. I know on our campus, it was a novelty to reach out to students in recovery. It shouldn't be. We should make the campus welcoming to students in recovery. When we think of other marginalized groups, and I'm going to say students in recovery are a marginalized group on college campuses because they're misunderstood. Depending on your ego strength, depending on how old you are, you might, if somebody says you're sober, or that you're somehow you're a dud, I'm betraying my age right now. I'm sure there's a more hip way to say that, a more Gen Z way to say that, but the lack of support is still there, and so embracing students in recovery, not expecting them to do what the group's doing is an important piece of that, but also just making yourself aware about the different kinds of drugs and what is on your campus, and being able to balance the branding of your campus and parental concerns with what's happening on the ground. It was ironic. My very first job in higher ed in 2000, had never been in the field before. I was a clinician, had been a clinician, and so my very first introduction to higher ed, it was orientation. And so literally on one side, there was one auditorium that had the parents, and there was another auditorium that had the new students. And I walked across the hallway from the parents group, where the dean of students was telling the parents how safe this community was. And it was an abstinence, school. There was no drugs or alcohol. Across to the student side, where the orientation leaders were telling students, this is awesome. We're 45 minutes from downtown Tampa, and we're 45 minutes from Orlando. There's all sorts of opportunities to party. And I thought to myself, how can the institution have these two very different messages operating at the same time, literally across the hall from one another?
Yeah, amazing. So
this was also a dry campus that you could come in on any Monday morning and find the trash cans full of bottles, beer bottles, liquor bottles. So I quipped that it wasn't a dry campus, it was humid.
Yes, there's a lot of spinoffs there. Just as you're talking about staying current, in our resource, in our document, the strategic on professional competencies, for each of the 8 areas, we have resources. And on the drug and alcohol area, we have 2 pages, probably 20 resources with URLs right there. And then you also talk about data. Again, in this guide, we have a couple pages on data sources. Where can you go to get current data? Now that's national level, and you're talking about getting local level. But the other thing that you were talking about, going back to, again, this 8-part model that we have for the drug and alcohol arena, is about recovery. So tell me if this is a fair statement. Do you believe that the larger majority of people do not really understand what it means to be in recovery? The vast majority of people, talk about a college campus, or you can talk about society. What's your sense? Do people understand recovery or not? My sense is they don't get it, the general person, but you're the expert.
Yeah, so I think there's a continuum of of people who misunderstand recovery, all the way to people who stigmatize recovery.
Okay.
And recovery from substances can be very stigmatized. There was a study done, and I can't quote it chapter and verse, but it went kind of like this: that like 90% of respondents, when asked if a family member, if they were okay with a family member dating somebody in recovery, they said no. And when it came to mental health, it was about half that much. And so the stigma of being a drug addict is still there. But the reality is that there's people do recover, and they do quite well. And one of the things, generally speaking, people who are addicted tend to be pretty bright, and you have to be to manage all the things that are going on. It's like an acrobat, and you keep all the plates spinning. You have to have some skill to do that. And so when people get into recovery, they unleash a power, and they really do good. And they're innovators and disruptors, and they're folks that we need. They solve big problems.
So for a campus to be supportive or embracing and understanding of recovery, what are some of those key elements for, if you will, comprehensive recovery services for a campus?
Yeah, well, I think the very first thing is you don't want to bury it.
Okay.
There was a school I consulted with that had a recovery program, and they buried it off campus. And their idea was, oh, we don't want, we want them to have privacy. Well, maybe they did, but maybe they just didn't, in the center of campus, want a big sign that said recovery. And and so that's something you have to be honest about. And the feedback I got from students when I talked to them was they did feel alienated. They didn't understand why other student groups had space on campus in the middle of the campus, and yet they were relegated to the fringe of the campus.
Yeah.
So support's important. Addressing myths. It takes some courage to recognize that your experience with somebody who's has been addicted or has a substance use disorder isn't universal. That was another thing I saw among not just administrators, but faculty and staff as well, as they had a brother or a cousin or an aunt who had really disappointed them. And so, they had a substance use disorders and let them down. And unfortunately, I saw these folks in positions of leadership. They would generalize their experience with the person, their personal experience with substance use disorders, generalize that to all people with substance use disorders. And, in my mind, it does real damage.
Yeah, that's helpful.
Yeah, and so it takes a level of insight, takes a level of courage and leadership to step outside your own experience and allow people to teach you about theirs.
Good. So as we look at, again, the 8 elements within the drug and alcohol arena, is there any one or two that really jump out to you as I mean, we've talked about a couple of these, but do you have any priorities? I mean, you may say all 8 are important, but I know they're all 8 are important, but is there anyone that really speaks to your heart, or that's you're really passionate about more than any others?
Yeah, so for me, having the background in treatment and then being in a leadership role, I really struggle back and forth. I do think at the macro level or at the leadership level, that's where we can do the most, have the biggest impact, but also cause the greatest amount of harm. Because we either encourage people to have a healthy relationship in respect to substances, or we drive them underground. And then our clinicians, especially on a college campus, it's important for them to understand their blind spots, as well as to stay very current in the literature. And if harm reduction is fashionable on your campus, that's something, to whatever degree, that's important to implement. But at the very least, be educated that addiction happens and recovery works.
Good. So let me dive a little bit into what does it mean to have a healthy relationship with substances? You're talking about the health enhancing environment for the campus, but what does it mean to help? You're talking about students having a healthy relationship with substances. What does that mean? Because you're substances that are legal and illegal.
Right. So it goes back to that dichotomy, and I'm certainly not advocating for the responsible use of cocaine. But when, typically with legal substances, we talk about moderation. Okay. And so that's what I mean about a healthy relationship with substances. However, on the other hand, if I'm a clinician and somebody who's using cocaine daily says their goal is to go to every other day, I'm not going to tell them that's a terrible idea. You have to abstain altogether. And so, so that gets a lot more tricky on a college campus. And, that's not a message you're going to put out
right.
To the public.
Yeah. So, but it's that harm reduction is helping a person reduce their use, reduce their reliance. And when you're talking about healthy relationships, I assume, just clarify if you disagree. So there's the health piece, there's the safety piece, there's the legal piece. I mean, alcohol, 21, marijuana, different laws are changing. So it's monitoring healthy and safe, and safe, even though it may be legal. You may be 23 or marijuana might be legal in a certain circumstance, but it may not be safe.
Yeah, well, a DUI is still a DUI, right? And drunk and disorderly is something that you have to deal with, and so it is across the gambit, and I think it's really speaks to the being informed. But on the other hand, people who drive under the influence repeatedly are people who have gotten to the point where they're using illicit substances on a regular basis. There's an experience of trauma. There may be there's a lot of different reasons it progresses to that point, and so education at that point isn't optimal. That's where treatment is really the best course of action, so they can understand how they've gotten from point A to point B. Yeah, and actually, point is point D or F or G actually.
Yeah, and just another spin-off on the making healthy decisions. Just because you're not diagnosed with a substance use disorder does not mean it's not a problem. Correct. You mentioned DUI. Someone can have they drink too much. There's no dependence, no addiction, no disorder, but it's a problem. Yeah. And but then the other piece goes back to the very beginning. And again, of what you were saying is there's a lot of people who don't use. Mm-hmm. There's a lot of people who don't use illicit substances. There's lots of people who don't use alcohol for whatever reason. And it's supporting those healthy decisions, creating a campus environment, again, acknowledging that whole continuum of use from no use to problematic use, if you will. Yeah. And being intentional about that.
Yeah, it's very important.
Yeah. So how about any other examples or ideas that help to bring the importance of this entire set of 8? So any other thoughts that bring it to life?
Well, I think we have to see people as the whole and not the parts. And so I think those 8 parts are really important. Okay. But the real skill involved is to figure out a way how to manage all those parts to create a campus that's health producing, as opposed to creating issues that may lead to longer term consequences. I'm just amazed at some of the culture on campus where we reward those risk-taking behaviors, and then like a DUI. I hire people And that's one of the first things, they do a background check, and so it's a big deal. It's not something that, oh, I was in college. That can follow you for a very long time. And so I think we have to do a better job uh, on campuses that promoting that there's alternatives to the party scene. And I want to say, I want to talk about this. We tend to pick on fraternities and sororities a lot. And I read a report just the other day that fraternities and sororities are drinking more than ever, and more than anybody else on campus. And I want to point out that when you make a statement like that, you're assuming that all the other people, students, didn't use drugs in a harmful way. There's a lot of people who use substances in a harmful way that don't wear letters, and they're not easily identified as a group. And so, so we have to, again, be careful that we don't create a culture that reinforces the negative behavior, and that really doesn't give an alternative to healthier use, because everybody from the beginning thinks you joined a fraternity because you're going to party hard, and these are your priorities, and it leaves out the philanthropy, it leaves out the leadership, it leaves out the networking. So there's a lot of positive attributes to Greek life.
Absolutely.
Unfortunately, they're doing a terrible job at brand management, and part of that's on them. But I think part of that's on expectations and attitudes that it's only the Greeks. When we know from the data, there's a lot of students who drink in risky ways. They just don't all wear letters. They're not all easily identified as groups.
Right. So one last question before we start to wrap up, and looking at any other tips and messages. But again, in this model, this 8 pieces, there's something called oversee stepped care approach. Can you talk about a little bit about stepped care? What does that mean?
So I sort of I talked about that a little bit, but I'll be more precise in the definition. So when somebody presents with a problem, whether so it could be they got caught in their residence hall life with alcohol, and so a stepped care approach is doing an assessment. Does this person need prevention, education? Do they need group intervention from the prevention side? Do they need a face-to-face kind of a basics type intervention, or do they need treatment? Do they need to be referred to a clinician who can determine whether they have a substance use disorder or not, and then to provide them strategies to do better, to succeed? And then that stepped care approach, really it ends in recovery. If you don't step out of the problematic behavior anywhere on that continuum, hopefully at some point that you step out when it gets to the recovery side, and you embrace your own health and well-being.
Okay. Yeah, that's helpful. I just think that language, your description there helps pull it together. And again, that goes back to the protractor part that you were talking about at the very beginning. You've talked about fraternities and sororities, but are there any other specific audiences, whether they're student or student group based or non-student, could be faculty, staff, administration, community, whatever? Are there any other audiences where you have a special message or something specific for them that they need to be considering as it relates to the competencies, and most specifically the drug and alcohol element?
Yeah, so I'm probably not going to answer the question the way you asked, but
that's all right.
Yeah. But I will say this, I think anytime somebody comes to our attention with a potential substance abuse or misuse, that's an opportunity to determine whether this is more or less problematic. And so I want to go back to the fraternity and sorority. they're an easy group to follow because they all wear letters, and
Right.
so it's you know who they are and you can identify. It's a little trickier with those people who are in smaller peer groups, who may engage or who do engage in the very same behaviors. When we look at the data, we know that 100% of the high-risk drinkers aren't Greeks, right? There's a big population of students in general who are high-risk drinkers. So we need to look for opportunities to find them so that we can intervene. And because they don't bring a lot of attention to themselves in terms of very public, say like with the Greeks, anytime there's an issue, that's where you want to explore a little bit and learn more about that person, learn more about what's happening in their lives, and what their substance use is, because you may find that those are some of the folks that are using substances in dangerous ways, who are flying under the radar. Because they don't fall into one of our three high-risk groups:
Right.
Greeks, fraternities, or fraternities, sororities, student athletes, and I think club sports.
Right.
So that's a great way to make us feel good that we're doing we're making a difference, because we're working with these groups. But I think we're missing the larger picture, that there's a lot of individuals or small groups that are engaged in the very same behavior that we don't know who they are.
There's a lot of those in that small group that are high risk.
Yes.
Yeah. And then going back to your first point today is paying attention to the people who are choosing to not use, and supporting those decisions, supporting the low risk.
Yeah. So it's complicated. And I do want to clarify, when I was talking about, you're right that those people who are unknown or flying under the radar that are definitely exhibiting the same or doing the same kind of high-risk behaviors as those groups that we tend to think of when we think about substance abuse on campus. And I'm going to say something controversial, but you know me, and I tend to do this. But I think focusing on Greeks and student athletes and sports, intramural sports, that's easy for us to do, easy for campuses to do, but it's a lot harder to do the work of identifying those high-risk users who aren't so easy to identify. And so I think it's really important that you just don't stop at the Greeks or the athletes or the intramural sports when you're trying to impact substance misuse, abuse, maybe even dependency on a college campus.
Any other messages to administrators, decision makers, those who hold the purse strings, faculty members? Any other specific messages to those powers that be?
Yeah, I think getting out of your own way is an important message. This is wrapped up in so much, that it's steeped in the moral model. It's not seen as a medical issue, but it is. There's neural networks that get activated through habitual substance use, and so at some point, it's a response to stressors, and so we need to. And there's medications that treat substance use disorders, so we need to kind of get out of our own way and quit looking at this as a developmental stage, or as right and wrong or moralistic, and open ourselves up to the science and the medicine as to how to treat substance use disorders, which involves cognitive behavioral therapy, it involves medication, it involves supportive environments. So.
That's very nicely said. Go back to the science, go back to the science. And again, the good data, and then the resources that we've highlighted in this guide itself. So with that, any last closing comments from you, Dr. Hall?
Now, I think I've said enough that could potentially get me in trouble. So I'm good for today. But if you ever want to bring me back to make some more controversial statements, happy to do so.
Well, what I appreciate, Tom, seriously, is your candor, your insights, the blend of your experience that goes into practicality. So this is information. These are insights that we can use, that the listeners, the viewers can use as they help to orchestrate a health enhancing environment. And I know, and you were part of that discussion. This guide and all of its contents are aspirational.
Yes.
We can't get there tomorrow, but we can be planful. We can work with our prevention specialists on our campus. We can work with others, the key informants, the key decision makers, to help create a healthier and safer campus community and healthier and safer individuals. So in closing, I want to thank you, Dr. Tom Hall. I thank the Mid-America PTTC for their initial funding for this to help create this resource. Again, Rich, I thank you and your colleagues at the Drug Enforcement Administration for sponsoring this webinar series and for all of your good work. And in closing, again, this is an opportunity as we continue to make our campuses healthier and safer, and helping our students, as well as faculty and staff and our visitors and our alumni, if you will, to lead healthier, productive lives and fulfilling their potential. Again, thank you all. Good wishes for impact with all that we're doing. Thanks.